Okay, great. Thank you all for coming to this afternoon's Science Lab session. We are going to change the schedule just a bit. So on your program, Andre Kamal is listed as our first speaker, but we're going to shift and start with Tomasz Jerzyński. So just for those of you who are looking for any scheduling updates. So to introduce myself, I'm Hanna. I'm the head of scientific regulation at BAT, and I'll be chairing today. So we've got a great lineup of speakers. And like I said, we'll kick off with Tomasz Jerzyński. He's speaking on the global survey of consumer organizations advocating for safer nicotine products. Thomas is a sociologist and data scientist at the Robert Zając Institute for Social Studies at the University of Warsaw and works with Knowledge Action Change. He's a co-founder and member of the Polish Social Data Archive team and the head of Center for Social Research Methodology at the Institute for Social Studies at the University of Warsaw. Thomas is also a co-author of the Polish General Social Survey and a team of Polish researchers in the edition of the International Social Survey Program. So with that, we will welcome Thomas and his GFN5 video, and we will kick things off.
Hi, I'm Tomasz Jerzyński. I would like to present to you the Global Survey of Nicotine Consumer Organization. At the beginning of 2022, we began to take an interest in the role and activities of organizations that advocate for the adoption of and access to safer nicotine products following a harm reduction approach. Other than some poorly conducted analysis of the Twitter activity of consumer organizations, we know that no research had been done into how many of these groups were currently active, nor how they were set up and run. We wanted to map the number of locations of this group, describe their structures, working methods, and funding, and reflect their achievements and the challenges they face. We believe it provides a unique glimpse into the world in which these groups are operating. The study clearly demonstrates the major imbalance in resources between these organizations and those opposed to tobacco harm reduction. But we hope it also provides these groups with an opportunity to learn from each other while gaining new insights into how the others are achieving their goals. In almost all areas of public health, affected communities are now seen as a vital part of the policy-making process, and the same recognition is long overdue in this field. Policymakers need to hear the experiences of people who have switched away from smoking and take note of their decisions are likely to impact people's lives. The aim was to map the number and locations of nicotine consumer organizations globally and describe their history, legal status, membership structure, objectives, working methods, and activities and funding. We identify active organizations through the use of existing networks and referrals. All identified organizations were contacted and asked to fill in an online self-completion survey through the representatives of the organizations. The data collected were cleaned and anonymized. Categorization and analysis of variable distribution was carried out. Responses to open-ended questions were analyzed quantitatively. 52 active organizations were identified. 13 in Latin America, 8 in Africa, 24 in Europe, 5 in the Asia-Pacific region, and 2 in North America. Most were established from 2016 onwards, and 39 were legally incorporated. All of the 52 consumer groups are grassroots advocacy organizations which developed organically from small groups of contacts, including through social media. They are small organizations, most operated with volunteers, with only 7 having any contracted or paid staff. Taking the research sample as a whole, there are 122 regular associates among all the organizations surveyed, and only 13 of these are in paid positions. Their reported objectives were to raise awareness about safer nicotine products, promote rights to access to safer nicotine products, and to advocate for a legal and regulatory environment in which safer nicotine products are available. 31 organizations had not received any funding support. The total global funding for all organizations was $300,000. None reported receiving funding from tobacco or pharmaceutical companies. All pointed to important achievements in the public debate about safer nicotine products and tobacco harm reduction. The lack of resources is reflected in the views of the organizations about what they would require to operate more effectively, including more volunteers, funding, skills training, resources such as briefing papers and documents, paid staff, and own language resources. Or listed important achievements over the previous 12 months. From awareness-raising work, media coverage, protests or social media campaigns, to more policy-focused activities, submitting evidence to government and regulatory consultations, taking part in public hearing or speaking to elected representatives. These achievements are thanks to individuals' dedication and because they believe it's the right thing to do. Advocates do it because they don't want to see the products that helped them quit smoking taken away from them or from other people. There is a major imbalance in resources available to groups which are for or against tobacco harm reduction, thus muffing the debate in this space. Our study has shown that consumer organizations which advocate for safer nicotine products are run by enthusiastic individuals, most of whom have successfully quit smoking with the help of safer nicotine products. These organizations depend on the goodwill and input of a small number of core workers. They are extremely under-resourced and potentially fragile, and yet they report significant activity and successes in promoting tobacco harm reduction. Here we have only covered part of the results obtained. Please see the article we published this year in the journal Public Health Challenges entitled Global Survey of Consumer Organizations Advocating for Safer Nicotine Products. We would like to thank all the organizations very much for their willingness to take part in our survey.
Great. Thank you so much, Thomas. I was just curious if you'd like to add any other comments.
It's hard to say something more than that, but we hope that our survey was important and necessary tool for learning about the tobacco harm reduction environment. A mission of tobacco harm reduction advocates has always been clear: to protect the health and well-being of our communities by promoting the development and availability of innovative nicotine delivery systems that reduce harm compared to traditional tobacco products. However, in the public consciousness, it's not universal. The data we have collected is a testament to this collective effort and the progress that consumer organizations have made to the development of safer nicotine tobacco alternatives. As a reminder, this was a descriptive cross-sectional study employing an online survey conducted between March and 2022. We were able to identify 54 active organizations, and replies were obtained from 54 active organizations, and replies were obtained from 52. The survey aimed to understand their perspectives on safer nicotine products and their role in public health. The data collected from this survey was collated, summarized, and presented in the form of journal article. It's not this year, but the previous year. Consumer organizations advocate the development and availability of safer nicotine products, as they have the potential to reduce the harm associated with tobacco use, especially among those who continue to smoke despite attempts to quit. It is important to note that these organizations do not advocate for the promotion or normalization of nicotine use, but rather support the development and availability of reduced risk alternatives to traditional tobacco products. They emphasize the need of rigorous scientific evaluation and regulatory oversight to ensure that any new nicotine product meets the highest safety standards. The survey results also highlighted the importance of consumer education and empowerment in this area. Consumer organizations believe that providing cessation tools and accurate information about their relative risk is crucial for enabling individuals to make informed choices about their health. Advocacy for safer nicotine products could potentially and actually lead to significant public health benefits by reducing harm associated with tobacco use. However, it is essential that the new products development in this area is based on robust scientific evidence and rigorous regulatory oversight to ensure consumer safety. That's all. Thank you.
Thank you. And are there any questions from the audience?
Yeah, Christoph Neubert from Germany, PMI. Since you mentioned that the method was a cross-sectional study, I was wondering, you claim that all the organizations are very fragile due to under-finance. Are you planning of redoing the survey, asking them one more time and seeing how they have progressed or whether they have closed down and what the reasons were for closing down?
Yes, we are planning the next wave of the study. Maybe this year or maybe next year. It's only projection for now.
Thomas, I've got one. You know, in the face of innovations in products, how have consumer groups helped address some of the concerns about a variety of nicotine products and concerns about various options in some tobacco control groups about this?
Sorry. The most important in the work of consumer organizations, the most important thing is harm reduction approach, and this is ensuring access to the safer nicotine products for all smokers. And the next is regulations which should be proportional to the risk posed by each type of nicotine delivery systems. Next, it could be ensuring that health warnings are factual and not mislead consumers about the relative risk of different products. Next, it could be debates about flavors, bans, or restrictions. Of course, balanced, proportional to the risk taxes, and using tax revenues to fund public health campaigns or cessation programs.
Great. Thank you so much. Anything else from the floor? All right, great. Well, with that, we will move to our next speaker.